So, my name is Barbara from Nashua, and the question I have is about, Medicare. What can you do to help, the seniors with the price of drugs and the cost of the Medicare and things like that? I mean, it's some of the drugs are just ridiculous. The price of the drugs. And you look at, say, Giants for diabetes, which there's a ton of people on that now, and even with the co-insurance, it's still like $135 a month. I mean, somebody that's on Social Security, how are you going to be able to afford that?
Well, there's so much wrong with healthcare in this country, and it starts with the fact, a lot of it starts with the fact that the federal government decided this was going to be their area of expertise. I mean, everybody's dealing with inflation right now. Inflation has, raised the cost of the average family about $700 a month since Joe Biden took office. It's $8,400 a year. And that, when they report those numbers, sometimes they exclude food and energy, which are the highest components when they say that piece. But if you go back to 2000 forward, the part of our economy that had the highest rate of inflation that whole time was healthcare. It didn't matter, what was going on, not going on. Obamacare, which is a non-actuarial sound insurance program that less than 10% of Americans use, but it was 100% of the news for more than a decade. But it didn't change the cost structure. But the federal government kept shoving more money, keeps subsidizing into it. They did a bunch of stuff where they were subsidizing software, which then drove they subsidized electronic healthcare records. I mean, there's $1 trillion consumed of IT expense into the healthcare, and at the end of that decade, doctors were seeing fewer patients per day than they were at the beginning of that. The way you get prices down in an industry is you get productivity up, you get services up, and that happens through competition. So when the federal government is trying to do this thing, it's just awful. And it's like, so they got their hands in what was private sector with all the reimbursements. Then there's the VA, which has got challenges. Then take a look at it. They have another one, a federally run healthcare system. It's called the Indian Health Service. It serves the tribes in this country. It makes the VA look like the Mayo Clinic. And so if anybody thinks the federal government can run a healthcare system, go talk to a Native American that's trapped in that system, and you'll find out that that's not the answer. But on your question, so then how do we get the cost down? Part of it, we got to have transparency. It's the only thing. When you guys go to buy a car, you can actually see a sticker on the side of the car, used or new. This is what the car costs. You go in for healthcare, you have no idea sometimes what you're buying or what you're, and even if groceries are too high, you can look at the sticker and go, what's the price? I can't afford it or I can. But we've got no transparency in pricing. The drug issue, I mean, why does Canada have the same drug for a fraction of what we have? I mean, I talked to somebody the other day, and he just said, yeah, I stopped prescribing U.S. drugs. I just tell people because they're not enforcing it. I just give them, here's the address of a Canadian pharmacy. Go get the same drug for a fraction of the price. I mean, why are we why with our neighbor to the north, which is so close here to North Dakota and New Hampshire, why would we not figure out a way to have the kind of pricing that Canada does? So there's a bunch of stuff that I just call business operations related. Get the government out and get some common sense in, and we can absolutely take the cost down, just like we can. But part of this is it's not more government programs. We're like, oh, healthcare is out of control. Oh, we need Obamacare. No, healthcare is out of control. You need to get it back so it's like other industries where they can actually deliver services. So it drives me crazy because I worked in the software field in healthcare for a while as a CEO, serving those services after Great Plains. We went to there's a national show of innovation in healthcare, and it had the most exciting things that were going on there. I mean, like thousands of new startup companies that were all going to take the cost out and improve services. And then along came this $1 trillion I'm talking about, where the federal government said every hospital and every clinic and every doctor has to use electronic healthcare records, and we're going to give you $30 billion to subsidize it to start. And then when they found out 2 years later people weren't using it, they said, "Oh, we're going to cut your Medicare and Medicaid reimbursements unless you start using it by a certain date." We've never forced an industry to buy a certain company's software until this one. Okay, we've never done that. And of course, those people that owned those software companies were big donors of Obama. And so it's all political payback in my mind. It wasn't like, oh, the best software wins. And then there was a bunch of promises about how that was going to allow you to move your medical records around. Have you guys ever tried to move your medical records around? When I blew my Achilles and I got an MRI in Milwaukee, when I was there for the debate, and then I'm like, I want to go to the doctor back home. They're like, well, no, but we can give you a CD, we can give you whatever. I'm like, what? It's like you can't just send an email file. I mean, what? It's 2023. Oh, well, they've got a different system than we do, so we can't move it around. I'm like, so I spent weeks trying to just get basic like imaging stuff moved around, which should have taken like 2 seconds to do that. Well, this is all. So anyway, I'm frustrated, but I tell you, at that innovation show, because of the subsidies and because of the penalties to use that, I went to that show 7 years in a row, and each year I went, there was less small businesses, less startups, less new innovation. They're all going out of business. All the venture money that went in to create innovation that would have lowered all of our healthcare costs and improved all went out because all the capital went towards where the government was subsidizing. So there's two things that are wrong here. One is they were picking a winner that was a bad solution, and then they killed an entire industry. We lost a decade or more of innovation because of that, and it was all silent. Nobody reported on it. Nobody did. Just every year I'd go there and like, where are those guys? Oh, they went out of business. Because why? Well, 90% of every hospital budget was going towards implementing the electronic healthcare records. No one could do anything innovative. So I've just watched the government basically one thing after another raise the cost and lower the quality. And I don't know if any other candidate has actually seen it happen. I've seen it happen, and we've got to reverse that. If we can get back to driving innovation, then we can start lowering the cost, improving the services, get back to some negotiations, the PBMs, and all these other folks that are controlling drug prices. We just have to get in there and get it all fixed. But it absolutely has to happen. It's unaffordable.
And no, I agree. I'm a retired nurse, and it's just having patients trying to jump through hoops to try to get their medications for them is crazy. So, but thank you, I appreciate it.
Yeah, and I want to just say, hey, look, some people have said, well, you're not going to win because your answers are too long. I'm sorry, I just know too much. I mean, I understand what the problems are, and I would know how to dig in there and figure. And I'm not Mr. Soundbite. You want Mr. Soundbite? You want someone reading a teleprompter? Go someplace else. But I actually get what's wrong with some of this stuff because I've lived it. So, sir.
Yeah, my